In this video, I'll be talking on fowl cholera. It is a bacterial infection caused by Pasteurella motorcida, right? So I'll be telling you on the signs that you are going to see anytime your birds come down with the disease condition known as fowl cholera. All right. So this disease, it is also important for us to know that this disease affects other birds. So birds that are 6 weeks and below may not be affected because it's only the older birds that normally come down with the disease condition. Now the signs that you are going to see is the major sign you are going to see is vascular disturbances. Right, it causes vascular disturbances. You can see on the skin of the bird, you can see bluish discoloration on the skin of the bird. That is, some part of the bird skin can turn blue or green. All right, then if the bird is matured enough to have comb that thing that is, that structure that is pointing on the head, that pinkish structure, if the bed is matured enough to have that comb, the comb can turn black or dark in color. All right, then if you see that, you are most likely dealing with fowl cholera. All right, then another sign you are going to see is in the physics. You will see whitish physics, whitish water physics at the initial stage, but with time it will turn to green. But it is not anytime you see your bed passing out whitish watery physics or whitish watery physics mixed up with greenish physics, you now conclude that the bed have come down with fowl cholera. You must see this bluish or greenish discoloration of the skin, and also the wattle and the comb. All right, so you must see those things before you can now conclude that this bird has come down with fowl cholera. Another thing you're going to see is, if you look at the nostrils of the bird, you will see watery discharge. All right, so water will be coming out from the nostrils. Then that is another sign of fowl cholera, and the bird will have difficulty breathing, a condition known as dyspnea. The bird will experience difficulty while breathing. Okay, so these are the three major signs you are going to see in fowl cholera: that bluish discoloration of the skin, and the darkening of the combs and the wattle. All right, we call it cyanosis. You can also see that sign in avian influenza, um bird flu. You can see that sign in bird flu, that cyanosis in bird flu, discoloration of the skin and the wattle. But in avian influenza, there are other signs you are going to see that will make you to conclude that this one is avian influenza and not fowl cholera. And in avian influenza, you can see, in addition to the cyanosis, you can see watery discharge from the eyes. You can see the eye. The eyes, there will be excessive lacrimation. Yes, that is the word. Excessive lacrimation or tearing. All right. So once you see that, then you are most likely dealing with avian influenza. Okay, and it is a zoonotic disease. That means a zoonotic disease is a disease that affects animals that can as well affect human beings. So for the treatments, if you want to treat this disease condition, you make use of a broad spectrum antibiotics because it is a bacterial infection. So you are going to make use of a very strong antibiotic, the one that has effect against Pasteurella organism. All right, it's most specifically Pasteurella motorcida. So I will be going for ciprofloxacin. Is a drug of choice for this disease condition. All right, so because of the difficulty in breathing and water discharge from the nose, that is a sign of respiratory distress. You can combine your ciprofloxacin with tylosine. Okay, so because tylosine is a drug of choice against any respiratory infection or respiratory sign at all. Okay, so you can combine these two and give these birds this drug in their drinking water for 5 consecutive days.